All right. Well, hello, everyone. Good morning. Thank you so much for joining us. My name is Emily. I'm from the Southeast MHTTC here at Emory University. Just want to welcome everyone to our fourth and final session in our Perspectives in Crisis series with the Georgia Mental Health Consumer Network. Just wanted to say hello before handing it over to Sherry and remind everyone to please stick around to the very end of today's session for our Stamps Are Required survey so that we can continue to provide events just like this one for peers across our region. So without any further ado whatsoever, I'm just going to go ahead and turn it right over to Sherry so that we can get started.
Thank you so much, Emily. Really appreciate that. I'm Sherry Jenkins Tucker, the Executive Director of the Georgia Mental Health Consumer Network. We're so delighted to be able to do this work in conjunction with the Southeast Mental Health Technology Transfer Center. Welcome to everyone from across the 8 states of the Southeast Mental Health Technology Transfer Center, and everyone else that has joined us from across the country. It's so wonderful to have you here. We really appreciate everybody joining us, and we appreciate our panelists and presenters and the Southeast Mental Health Technology Transfer Center. Today, we're going to be focusing on redefining mental health crisis, building resilience. And we have a panel who will be sharing their stories with us, and we will be providing you with some tools to support your resilience. I am so happy to be with you today and to turn it over to Rosalind Hayes. Roz?
Thank you and good morning. My name is Rosalind Hayes. I'm a person in long-term recovery and Director of Peer Support Services and Training for the Georgia Mental Health Consumer Network. This is our fourth and final in the series in redefining crisis perspective, and I'm very excited and curious to hear from our panelists this morning. Doing this work has been particularly rewarding for me over this last year, or over the last 3 or 4 years that we've been involved with the Southeast Mental Health Technology Transfer Center. And the timeliness of this series has been really rewarding. And with that, I will go ahead and turn it over to our first panelist. And I'm not sure who wants to go first. We have Denise, Tatanisha, Jennifer, and Bill. Which one of you wants to be the first? Look at that. Look at that. I'm going to call on my friend Tatanisha. And from there, we'll pass it off. Okay?
Sure. Hello, everyone. My name is Tatanisha Frazier, and I'm a person in long-term recovery. And what that means to me is that it has been 11 years since I've had any challenges with my mental health or substance use. I am grateful to have an opportunity to talk about resiliency and how I have been able to work through and manage staying better and well in my recovery. And I just want to hear the question one more time so that I'm clear about what I am stating.
If you'll share with us something that is some of the adversity that you've experienced through your journey and the ways that you've been able to remain resilient and bounce back through those things. And I know, just because I know you, that you have kids, and that's been a particularly challenging area. And I'm sure you're not the only mother on the panel, or you're not the only mother who's joined us. And if you could focus on that part and the challenges there and how you've managed to, come through that would be awesome.
Thank you. Well, so as a mother in long-term recovery, a lot of the adversity and challenges that I have faced have been centered around my own children's wellness while maintaining my own wellness. And it has been a very difficult journey, one, because as a mother, when you lose custody of your kids and you regain custody of your kids while you are trying to find wellness, it is hard to balance all of those things. You're dealing with parenting out of guilt. You are dealing with emotions of the children that you are parenting. And for me, my kids were confused, angry, sad, and had a lot of questions. And I too had those same types of feelings and didn't really know how to deal with it. Like, it was hard. When you have kids who are in a new environment and they have to start in a new school and a whole new group of people, it is one of those things where as a parent, you do what your parents taught you to do. And I messed up quite a bit, because I was conditioned to think that I was supposed to punish my kids when they acted out. And what I learned is that they needed space to just be who they were. They needed to feel safe. And so I had to learn how to undo conditioning that I was raised up with to actually be there to listen to my kids. And so we cried a lot. When I got my kids back, we were in a 1-bedroom apartment. And it was a large 1-bedroom. It had a big walk-in closet that we figured out over time that we would use that space whenever we needed to get away from each other. Because when you're in a small place, everybody does not have their own space. And that was really hard. Like, we had to figure out that when someone is needing personal space, that we have to figure out how to do it. And so working in that small space taught us how to respect each other's space, but also how to advocate for, I need somewhere to be where nobody is around me. And so the closet became everyone's space, even though my kids never really respected my space. When I went in that closet, they were always knocking on the door. It was one of those things that was really hard. Like, and then going to the school and having to advocate for them. And advocate for them in a way that says, okay, my kids are having challenges, I'm having challenges, and I don't understand. Or I don't know what to do, or listening to counselors tell me that there's something wrong with my kids when really they were just dealing with a lot of emotional stuff. And so that was really hard. And it really challenged my recovery because I dealt with a lot of physical pain and emotional pain as a result of how I had to step away from my kids to get help. And so, over the time, we found ways to coexist in such a small space together. And we did a lot of walks in the park. I explored nature with my kids. That was the place that helped me get to my wellness before I got my kids back. And so we would go to parks a lot and walk on a lot of the trails. And that has been one of the key elements of how I've been able to maintain my resiliency and recovery, is that I have these spaces in the places that I live, or, in the city of Atlanta. The parks and trails are just abundant. And so I have watched trails come up all over the city that, when they first started out, like the Atlanta Beltline, I used to take my kids down there, and I've watched it just evolve since the beginning. And so those are some of the things that we have done as a family together, is to just get outside because we had such a small space. And then just learning how to advocate for myself in my own recovery. And then that gave me opportunities to help them advocate for the things that they needed in school. So it wasn't easy. Like, I have one daughter who just graduated from high school, and I have one who has decided she wants to get her GED. And so I am supporting her on that journey. And it's very difficult because people place judgment on you based on how you parent. And most people think that the traditional pathway to their life is that they have to graduate from high school. Well, I'm here to tell you that I did not graduate from high school. And I am an active person in recovery, and I take care of my family without a high school diploma, you know. And so I am walking with her along a journey that I was on as a person who had to get her GED. And so I respect that that's the choice that she wanted to make. And that was hard because my conditioning kept telling me she needs to graduate from high school. And her sister did, and she just recently graduated. And so some of the things that we do as a family is we talk to each other, listen to each other, family meetings. There was a lot of anger. So I had to create spaces for my children to feel safe. And what I learned is that I needed to feel safe. So I started creating that space of safety for us. And one of the promises that I made to my children was that our home, wherever we live, is going to be our safe space to be whoever we want to be. And that as a mother, I will support you in that. And that opened up a lot of opportunity for my children to be who they are. And they have grown up to be beautiful, healthy human beings who feel supported and loved for who they are. And that is not something that I received growing up. And so as a parent, I feel really strong in my recovery because I have learned how to do that for myself. And I'm now doing that with my children. And so, you know, the adversities of being a parent in recovery while trying to take care of yourself as an African-American mother, watching my son grow up in this world where he does not always feel safe is hard. That's adverse. That's adversity. Every day I'm concerned about his health and well-being. And he's a nice, kind person, but he could also be caught up in a situation where he's at the wrong place at the wrong time and his life can change. So, you know, I have conversations. So communication is really one of the things that I do with my kids to keep them aware of what they can do to stay well. So they get to see examples of how I stay well and what I do. Which is to, you know, exercise, drink lots of water, laugh. I laugh a lot. I ask a lot of questions. I'm very curious about their lives. And it has really informed our way of being as a family. So communication, nature, feeling safe, and being able to just be who I am allows them to be who they are. And it's still a struggle. But these are the things that we do to maintain the family connection. And it has been a beautiful journey. So having a mother, having children, you know, who have one who has completed college. When I got them back, they were very young. So to see them really evolve through everything that has been happening in the world has been a real gift. So I feel supported. They feel supported. The community supports us, and we really do tap into our own communities. And I had to figure that out early because there was not a lot where I lived. And so we had to venture out to find things to do as a family together. And I did a lot of it alone first. By the time I got my kids back, I had a few things in place. So I hope that was enough information. Yep.
Thank you, Tatanisha. This was a pretty incredible story of resilience. Thank you. Bill, if we can hear from you next.
Hi, I'm Bill Jolly. I'm a person in long-term recovery. And what that means for me is it's been 6 years since my mental health challenges and substance abuse have made a lot of issues in my life. In 2004, things in my life started falling apart. And by 2006, I found myself without a job and I was homeless. And at that time, it really didn't matter to me because I was, my mental health challenges were, they had caused me to not be able to live my life the way I used to live it, the way I think I should be living it. So it didn't matter if I had food, it didn't matter if I had a bed, didn't matter if I had friends or family to talk to or to spend time with. So I spent many years on the streets, and in 2015, life fell apart even a little bit more. By 2016, I was in jail. And I had a lot of decisions that I learned that I needed to make. And so the first thing I did was I went to a program where I went in for 9 months. I spent time learning who I was, learning what was going on in my life. And, I learned what I needed to do, or what I felt like I needed to do. After that, I spent time in an aftercare program. I started surrounding myself with people who cared about me and who I felt like I could learn something from. Today, it's been a little over 6 years. I currently have a house. I purchased a new car. I have a job that I thoroughly enjoy. I love coming to work every day. I love being around the people that I'm around. I have a great recovery program. I help others who are going through the same thing that I went through. I sponsor several people in helping them to regain what they've lost in their lives, whether it's a car, a place to live, a job, or just being able to take care of yourself on a daily basis. I make sure every day that I get up, I have a self-care routine that I do. I also have a wellness toolbox that I can pull a lot of different things out of. I make sure that I clean my house every day. I make my bed. I put my dishes away. I cook meals. I love to go out into the community and spend time walking or spend time with a friend at a coffee shop. Those are things that I could not do when I was going through a lot of challenges. Just being around other people made me feel very uncomfortable. A lot of times I felt like, people were judging me when I realized they were not. They were concerned about me. There's things that we can do in our lives to make everything, for me, I can make everything better. And one of them is just reaching out to somebody every day, especially if you have something that's troubling you, something that could possibly drag you down. That's all I have.
Thank you, Bill.
Thank you.
All right. Let's turn it over to Denise. Well, no, we'll turn it over to Jennifer.
Good morning, everybody. My name is Jennifer Barnett. I'm a person in long-term recovery, and what that means to me is it's been 14 years since I've had to really stop and think about what I need to do for me today. And, I'm a person that is dually diagnosed. And for years, I was raised into a point of where I was to be seen and not heard, so I never had a voice. So whenever I started, my mental health challenges really started to get to me, I would self-medicate those. The adversity of just life in general sometimes is very difficult because I've had so many different traumas and challenges. But for me, I've always come back to having hope, and having that hope and being able to really think about what it is I need, finding my own voice, being able to advocate for myself of what I need. and just have a good support network. There's so many things in life that I have no control over, and finding the things that I can control today is what helps me. I really don't know how to explain some of the stuff, because there's been times that I've reached out and asked for support and asked for help with my mental health challenges, and they would just want to lock me away. So, that stopped me from reaching out to people and asking for the stuff that I needed. But today I feel that I'm a good person to be able to just speak up and let my voice be heard. And that's a big challenge for me, because I was always the one that never had a voice. So I don't know really what else to say today, except that I'm just grateful you guys are here and you're letting me talk to you, and I appreciate y'all listening.
So Jennifer, I'm not going to let you off the hook that quickly.
I dare you.
I know that you have had some adversity with your physical health here recently, and yet you continue to suit up and show up, and you have been able to stay on the path no matter how difficult it's been. And I know that it's been difficult. And if you can, share a little bit about how you're able to maintain your resiliency in the face of the adversity with your physical health. Bill, I should have gotten you on the same thing, day to day.
So at first, whenever I was diagnosed, it was like, people are diagnosed with cancer all the time, and, it's okay because there's cures for it. And then a few months into all of my treatments, I was told that the cancer that I have is due to a virus, so there is no cure for it. So with that, there again, I have to use my voice, because I go in there and I talk to them, what are the other alternatives that we can do? What do I need to do to, keep myself well? Because, first and foremost, I'm a mother and a grandmother, and my grandchildren are everything to me. That is my reward for not choking my kids out whenever they were younger. My grandkids are my reward of that. So, and, to think that I can't be around them and sharing my life with them, they keep me hopeful, because I'm going to see them grow up, and I take care of me today. That's all there is to it. I'm going to take care of me, because if I don't, nobody else is going to. And I have a job to where they're so supportive of what I need to do for me, and they're always there. They're always a listening ear when I need that, Roz, because you get most of it dumped on you. But, just being able to have that outlet, being able to talk about it, being able to know, even in this, I can and will recover eventually. So, it keeps me hopeful. You're muted, Roz, if you're talking.
Thank you, Jennifer. Thank you. And Bill, I'm going to circle back around to you as well.
Okay.
I know you've had some health challenges, and some of the things, just hearing, you have cancer, you have this or that is enough to blow a person away. Yet you all have been able to remain resilient and to continue to live your lives, and to not be thrown off course. And I salute both of you for that. And Bill, if you'll share a little bit about how you've been able to do that as well.
Okay. So last year in April, a routine blood test came back that I have leukemia. And so they told me that I had to go into the hospital and start a chemotherapy routine. And so I went into the hospital in April, and I was discharged in October. I spent 5 months receiving chemo every couple of days. And it was difficult. It was very difficult. But the one thing that my doctors all knew that I had some mental health challenges. They knew I had a past history with substance abuse. And so we talked all the time. They made sure I had the personnel that I needed to have around me to help me to figure out what was going on. I wasn't going to go through 5 years of recovery for this to, cause me some issues. So every day I worked on my mental health. I worked on self-care, and I worked to keep my spirits up, whatever I had to do. If I didn't feel like getting out of bed, I got out of bed. If I didn't feel like walking, I walked. And I made sure that I talked to people on the phone constantly. I was on Facebook, Instagram, emails, Zoom meetings, anything I could do to keep my mind occupied and to help me to process what I was going through. As soon as they released me, I had a week or two of a recovery at home, and I immediately went back to work, and I went back pretty much full time. And I've been working ever since. I am still on a chemotherapy treatment. I go 1 week every month. It's 4 hours a day during that week. I come to work afterwards. There have only been a few times where it was difficult to come to work, and so I worked from home. It's important to keep your attitude in a good place, because that can eventually, take you into a place where you don't want to be, or a place where you used to be, and that can cause, for me, it can cause challenges. Thank you.
Thank you, Bill. Thank you, Jennifer. Thank you, Tatanisha. Next up, thank you all for sharing some of what is some of the challenges and some of the ways that you've been able to remain resilient throughout and to maintain your wellness and recovery. Next up is Denise Hardy, and she'll share with us some tools and some things that we can do to help build and maintain resilience.
Okay, my name is Denise Hardy, and I'm a person in long-term recovery. I'm employed with the Georgia Mental Health Consumer Network for 6 years now. I love my job. I love what I do. I don't call it a job anymore longer. I call it an assignment and a calling to be able to support others. Resilience to me means bouncing back, and after some difficult times in my life, just being able to be there for myself. I was the type person that I would be there for everyone else, but I wouldn't be there for me. So I had to learn through a lot of trials and journeys and valley lows. I had to learn to be able to be there for me and to love me so that I could live my life out loud, even with health challenges, recovery journeys, hardships, just being able to be there for somebody else, and to also be able to know that I'm enough. I'm enough all by myself. My adversity that I faced was, not knowing my real purpose in life, not knowing my real purpose, always putting other people first. When my relationships would break down, I would break down. I had to learn that a lot of times it was not about me. It could have easily have been about the other person. But my relationships was built on me making sure I take care of everybody else. So of course, I lost some relationships along the way. But I also gained some new relationships, some connections, and some being committed to different tasks that I was assigned to. Just being that person that I know somebody else would need to get that connection from. being that person, being resilient and bouncing back even after several family members' deaths, even being able to have to move to another town in order to get the job that I love. I love my job today. And being able to just be resilient and having that strength. It's been 25 years since I've been in recovery, since I've had a setback, since I've I just keep going. I just keep going. I just keep going. No matter what gets in my way, I keep going because I know along the way, somebody needs to hear what I have gone through that would give them some hope and some responsibility and just being, oh my gosh, I just get excited about recovery. I live it every day, 24 hours a day, 7 days a week. Just being here and just being resilient, and regardless of the adversity, I don't let it get me down. I just keep going. I just keep going. Thank you guys for listening. Thank you guys for being here today. And thank you, Sherry, and all the GMHCN team. I appreciate you all. Thanks.
Denise,
Denise, before we let you off the hook, we want you to share with us some of the things that you do with your mission and your calling when it comes to whole health action management and wellness recovery action planning.
First of all, I pray. I pray a lot. I mean, it may not mean anything to anybody else, but I've got to say it. I used to wouldn't say it, but prayer is it keeps me going. Being able to have supports, my supports and my positive relationship connections mean a lot to me. And I have those 5 people in my network that I utilize. Just being resilient, being able to identify what restful sleep. I don't care what's going on. I'm going to get my rest. I can have a house full of people at 9 o'clock. I'm going to bed because restful sleep is important to me. Healthy eating. I might fall off a little bit on that, but I'm still a work in progress with that. A physical activity, at least 2 to 3 weeks, two times a week, I get out and do some physical activity. And avoid negative thoughts. Being able to avoid negative thinking has been powerful in my life.
So Denise, I'm still not letting you off the hook. Tell us what whole health action management is. What are some of those domains? What actually is
whole health action management? It helps you to reach your health goal. Even when I used to eat, okay, I'll use an example is this. I used to eat 12 donuts, 12 Krispy Kreme donuts. So I had to learn to not eat the 12 Krispy Kreme donuts for it's a healthy eating. As being diagnosed with diabetes, I had to learn to not eat the 12 donuts, but maybe have 1 or 2, not the whole 12. Okay. It's a self-management, being able to be in charge of, the things that you do for yourself. Being able to recognize that service to others. If anybody knows me, they know that I love to give. I love to give. I love to give to others. That brings me so much joy to give to others. Those are the 10, a few of the 10 resiliency, whole health and resiliency factors in the WHAM. And that works for me. Raj, you need some more.
Well, I want, we want people to know what WHAM is. We want people to know what RAP is, and to walk away with some tools for their own resilience.
Okay, the WHAM, it helps people to reach their health goal. It gives you the chance to put the tools you need to effectively manage your condition through the 10 whole health and resiliency factors, some peer support, some group activity, and some skills building and training. And it teaches you the self-management that can help you cope with health conditions or mental health conditions, substance abuse. It's just there to help you to create a plan. And it also requires some peer support. It requires some peer support in some group meetings. And it was developed by people in recovery from behavioral health conditions.
Here in the state of Georgia, in fact.
Yes. And a big component, as I was preparing for this morning, a big component I read on was resiliency. Resiliency is a very big part of the whole health action management. It starts with a focus on our strengths. It moves from focusing on our weaknesses to focusing on our strengths and what we are capable of. It doesn't just focus on your needs and your problems. It makes us think about how we can be successful and thrive in spite of great odds. It gets you to thinking about what the things that you've been told in the past that you couldn't do. Resiliency and the whole health action management gets you in charge of being able to think about what you can do, not what you can't do. So focusing on resiliency is a big part of a person-centered process.
I know whenever I took the WHAM training, it was always put to me like, and it stuck with me through the process of quit smoking. It's not about what you're losing, it's about what you're gaining. So you're not losing these cigarettes, you're saving $7, $8 a day, and you're building your financial future, so it's not about what you're losing, it's about what you're gaining. And that stuck with me harder than anything, because it's all about what I'm going to get out of it.
Because in that same sentence, you're creating new healthy behaviors. It's not taking things from you. It's focusing on what you want to create.
Denise, many of us are whole health action management trained and have carried the credential of whole health and wellness coach. But could you remind us of some of the domains in whole health action management?
Okay, some of the domains in whole health action management is the 5 keys to success. You're going to focus on those 5 keys to success and being able to be committed to the change that you create. One of the domains also is being able to focus on your whole person, not just focus on your mental health or your addiction. It gives you the chance to focus on your whole health as a person.
And along these lines, with regard to the Wellness Recovery Action Plan, could you share some of the high points of the Wellness Recovery Action Plan with us?
Sure.
And how how RAP and creating a RAP plan might be able to support us with our resilience.
Yes, I always share when I'm facilitating RAP Wellness Recovery Action Plan trainings, I often share that RAP saved my life. RAP saved my life back in 2007. I had no idea I was in a crisis. I ended up being in a crisis, and I ended up working the whole crisis, the RAP plan, to be able to have a plan when I was not well and when I was not in control, having somebody to take control. It empowers you to identify, to develop and identify some resources, some personal resources that are available, and being able to put those in a plan if the even after all self-help strategies have been utilized, and it also provides you a plan that you can utilize in a crisis. So when you're in a crisis, when you're feeling out of control, you're still in control because you have this RAP plan. And of course, it was developed by Mary Ellen Copeland, along with a dozen of individuals who she got together with and came up with the RAP. Also, the RAP has 5 key resiliency factors: hope, personal responsibility, self-advocacy, support, and education. Those are what the RAP is built upon. That is the foundation that the RAP is built upon. I'm gonna say them again: personal responsibility, self-advocacy, hope, education, and support. Because those are the five things that if we're dealing in a crisis, a lot of times I'll think about the 5 key recovery concepts to be able to use them in my daily life. Okay, do I need to go back and check to make sure I'm having some hope? Because without hope, there we don't have anything. Am I being personal? Am I taking it my personal responsibility to take charge of my life? Do I have a support system, or do I think that I'm an island and I'm just an island by myself? We all need support. We all need support. And also we need education. I told them the other day at a training, I use Google. Now that's my personal thing. I thought when they said education at first that I need to go out and get a college education, but I soon realized that education is being able to learn everything that I can about matters that affect me in my recovery. And being able to have that good support system, have those 5 supporters, because we don't want to burn them out. And also RAP has 7 sections. And the coolest thing about it, you don't have to use the 7 sections in order. You can utilize the RAP however it fits your life. Then we have the wellness toolbox. We have the daily maintenance plan. We have identifying stressors. They changed the triggers to stressors in the new book because using triggers was triggering people. So now it's identifying stressors and an action plan. And we also identifying early warning signs. How powerful is that? If you can identify the signs, if you can see your signs when they start happening, and then you create an action plan to deal with those, to cope with those signs. And also when things are breaking down, and an action plan. Knowing that when things are breaking down, everything's kind of out of control, and have an action plan for those things when they start happening. And also crisis planning and post-crisis planning. After all my utilizing my RAP, my support system, in 2007, I still realized that I needed to go into the hospital. And I used my crisis planning to be able to support that, which hospital I wanted to utilize, what treatment facility I want to utilize, what medications I wanted to use, and then my post-crisis planning, when I'm no longer in crisis and I'm coming back to my daily, work or activities. And that's it.
Thank you, Denise. And all of that is helpful, very, very helpful. We appreciate it. And just thinking about whole health action management, I remember participating in the initial study that I think ultimately whole health action management came from, and all of this, the Georgia Mental Health Consumer Network was a part of all of this. And you know, the idea that the head is not attached to the body, and that, you know, the focus for so long had just been on, that neck. And the focus so long had just been on, you know, what's going on in the head, and how we treat these quote unquote maladies of the brain. And you know, there's much research done to come to the conclusion that so many of us already knew, is that, you know, we are a whole person. And when it comes to wellness and resiliency, it's about the whole person, not just about, you know, what pharmaceuticals will support brain health. And I'm using some of this language with intent. And so, you know, out of that came those 10 whole health resiliency factors. And number one being stress management. We all know that how stress can just take the wind right out of our sails, and day in and day out, stress is really bad for the body. We've seen what happens when we live in fight or flight, and how that takes a toll on the body. And there's much of this came out of the morbidity study that said that people living with mental health concerns die on average 25 years sooner than the rest of the population. And it's like, what is that about? Why is this happening? Stress management being one of those factors. The number 2 in the list is healthy eating. And Denise talked about this. I'm sure we'll all understand the benefit of eating only two donuts rather than 12 donuts in one session. And it's difficult, for folks oftentimes to eat healthy, living on a fixed income, living in places where healthy food is not, readily available. If you're dependent on public transportation or whatever it is, in the neighborhood, what is it that is available? Junk food and things that are not healthy. I can remember working with folks and supporting peers who lived in group homes, and the kind of meals that they said that they were served. And so really, understanding the benefit of eating healthy, that the majority of our serotonin is found, is produced in our gut. It's not produced in our brain. 90% of our serotonin is produced in our gut. And so healthy gut health is important. And what we put into our body is important. Physical activity, restful sleep. Denise, you talked about that. Service to others, support network, connections. Everyone's talked about that. And I'm going to talk a little bit more about that later on. Optimism based on positive expectations. Recovery is the expectation. A good, healthy life, that we can actually have that as our expectation. And that's a real shift in thinking from what we've been given or told traditionally. Denise, you talked about that cognitive skills to avoid negative thinking, that catch it, check it, change it that we learn in CPS training, for example. Spiritual beliefs and practices, knowing that there's something greater than ourselves, whatever that is. It could be a tree, it could be, whatever works for us. But having those beliefs are important. And number 10 is a sense of meaning and purpose. What do I have something to get up out of bed for every day? And so I just wanted to fill in a couple of those gaps when it came to those 10 whole health and resiliency factors that we find in our whole health action management planning. And with that, and you can find these things, you can Google them like Denise just said. With that, I will turn it over. Thank you all, and give it to my friend and colleague, Chris Johnson.
Good morning, everyone. Hi, there I am. I am Chris Johnson. I am a person in long-term recovery and a person who's still trying to figure out his new webcam. Let me get the screen over here so I can see what you all are seeing. So good morning. First off, thanks to all of you for sharing your parts of your stories. It's amazing, how resilient we are naturally as people, even people living with mental health concerns. But then when we get skills and tools to help us sharpen that resilience, help focus it in on what we need to get through the next day, it's really amazing what we can and do get through. So I am going to talk about now when challenges get a little rougher, when things get a little more challenging and we do need support outside of our normal everyday at home in the community kind of supports and resources. And that's the Psychiatric Advance Directive. The Georgia Mental Health Consumer Network has been a part of the movement to get Psychiatric Advance Directive legal in Georgia for at least 2 decades. Is that right, Sherry?
At least 18 years.
Okay. So it's very important. Most states have psychiatric advance directives in place, right? Georgia was a little late to the table with this, not in working towards it, obviously, but in getting it passed into law to make these effective. And that happened this year along with the Mental Health Parity Act, which was passed by the Georgia legislature and signed into law by Governor Kemp. And the Psychiatric Advance Directive is in effect now, or July 1st, it goes into effect. And we are hoping to have the form ready for folks. The Georgia Mental Health Consumer Network is part of a group working towards making the form, which is a little, can be intimidating, a little more user-friendly for folks. But first I want to talk about a little just generally about, what is a Psychiatric Advance Directive. Let me pull up, I made some little notes here. Just generally speaking, Psychiatric Advance Directive, in some states they're called Mental Health Advance Directives. It's just a legal tool to allow a person with mental health concern the opportunity to say what our preferences are, in advance of a crisis. And they can serve as a way to protect our autonomy and, the ability to, self-direct our care. It gives us voice and choice in a legal framework. They vary by state. Again, Georgia was late to the table, but one of the nice things about Georgia being late to the table is that we were able to use from other states' experiences with psychiatric advance directives. And so ours follows the sort of traditional model, which is that it has two parts. It has an advanced instruction part and a healthcare power of attorney part. And in Georgia, as in most states, those two pieces are separate, right? You can have one in effect without the other. The advanced instruction can and does in Georgia detail the preferences for treatment, give consent for admission, and consent for contact ahead of time. It can detail preferred medications, treatment modalities, like some people may not want seclusion to be part of their treatment, right? So you can say that here. I'm one of those people that does not want seclusion as part of my treatment. It can also give instructions for attending to like practical stuff like childcare, who we want to take care of our animals, things that are important to us. The healthcare power of attorney can be used for medical or psychiatric emergencies. However, it is my personal suggestion, I won't speak for the Georgia Mental Health Consumer Network, that you have a separate document for your medical needs. The healthcare power of attorney forms may describe wishes for end-of-life care and other things. They can stand alone, they can work together, and it can be complicated, which is why we recommend working with someone, especially if you're confused by the forms, which honestly, I was in the beginning when I started working with them. So let's look at the Georgia form. Now, this is a version of the form, the Georgia Psychiatric Advance Directive. Sherry, how am I doing on time? Am I talking too much? I'm trying to talk fast so I can get through it.
You're good, Chris. You're good.
Okay, awesome. Thank you. So I'm going to walk you all through the form, and I'm going to share my screen if the computer gods allow it. Share screen 2. Okay. Okay. So the first part, very straightforward.
We can't see your screen yet.
The screen sharing is not happening.
Okay, what do you guys see? Because mine says that you
We
see
see you.
We see your wonderful face.
Ah, well, and that's something. I don't know what to do. Let me try redoing it. Back out of there. How about now?
We're good
We
to
can
go.
see it.
Okay, you can see it. Awesome. So there you see the many different versions of this form that exist on my computer. So just going through first, the statement of intent. I, Chris Johnson, being of sound mind, willfully and voluntarily make the psychiatric advance directive. So again, this is something we want to complete when we're doing well. This is something we want to do when we have access to all of the resources that we have, all of the names, phone numbers, addresses, websites, email addresses. Like, we want to have access to all of those things when we're completing this, because the more information we can provide to the people who are using this document, the better the chances are that we'll get the supports we think are most useful for us. Now, let's see, just going through here. I'm not going to read all of this because honestly, some of it is like kind of scary sounding, but I treat the scary sounding part sort of like I do the things in the, like whenever I upgrade my phone and it gets those end user license agreement terms, and I just say, yes, I agree to all the above. I just sort of do the same thing with these words. The first part is about our symptoms. Is number 2, but it's really the first part where we're filling out information. We say, then this is what happens with me, right? When I'm headed towards a not so great place, this is what it looks like. Then we talk about things that might make it worse, right? And for all of us, that's probably going to be a little different, but for me, something that would cause a mental health crisis to worsen would be like separation from my dog, right? So like keeping me away from my animal would not help. That would make my symptoms worse. Then how do you help me, right? We try to let them know these are the things that can help. When I exhibit the following behaviors, I would like to be evaluated to determine whether I have regained the capacity to make my mental health care decisions. It's a tricky one, right? But again, it's going to be different for all of us. And we're not required to provide answers for any of these, right? Because while we're creating with our allies in this work a form that is a PDF that you'll be able to, I'm sorry, I have a piece here in my eye, a form that you'll be able to fill out. In fact, the thing that the state of Georgia has provided would just be a piece of paper that you fill out and sign. It doesn't have nearly this much space, right? So don't be intimidated when you see this by the blanks on the page. Our preferred clinicians, here it has the names of doctors, therapists, pharmacists, and other mental health care professionals. That can include a peer mentor. That can include a certified peer specialist as well. Just whoever the people on your team are that you want to have contact with you and be a part of your wellness plan moving forward, go here. And that's why it's important to have all that contact information. And then just people that you consent to treatment from. You can list here. Importantly, I refuse to be treated by the following, right? So it's important to keep those names and numbers handy as well. Our medications, what we prefer not to take, why, things we're allergic to. If they have to give you a new medication, do you agree to it? Yes or no. The format of medication, the fact, do you want it liquid? Do you want an injection? Yes or no? Why? Hospitalization is not my first choice. This form assumes, we all assume, the hospitalization is not our first choice. If it is, you can write that here. But I've never heard anyone say hospitalization is their first choice for treatment. Sherry, have you? Sorry,
No,
Sherry.
Chris. No, Chris.
Okay.
I have not.
Sorry, I didn't realize you were off camera. Avoid these facilities. I refuse to be treated at this facility. This is how I respond to being hospitalized generally. This is how staff can help me. I give permission for the following people to visit me. You know, that's again important. And also it doesn't have it here, but when we complete this form, I'm actually going to have people add in a phone number or email here, because just telling someone, you know, I want Bill Jolly to visit me. Well, if none of them have Bill Jolly's phone number or email, like how is that helping them? Like help me, right? So we're going to add in space here for contact information for people. Like for me, you know, my family of choice is not my family, right? I love them, but if I'm in a clinical setting, I probably want to be surrounded by the people closest to me, and not all of those people are members of my family. Additional interventions, right? What else would you be willing to be part of as part of your treatment, right? Physical restraints. Are you willing to have that be a part of your treatment? Electroconvulsive therapy. Are you willing to have that? There are opportunities here for you to express your preference. Am I running over, Sherry?
You're doing okay, Chris.
Okay. Additional statements. This is the last part 2 of the first part. And this just basically gives you the opportunity to say whatever else you want to say. And again, the people reading this form, using this form, can choose to, in most states, including Georgia, follow or not follow as much of it as they want to. You know, I can put in this box, I need chocolate cake for breakfast every day if I'm going to get well. Someone might or might not respond to that. But if I don't tell them that that's really what I need and that makes me feel special and loved and well, you know, they can't do it. So this is an opportunity for you to put whatever you want to there. I realize chocolate cake is not a great example, but it's the only one I have for you this morning. Part 2 is essentially your the mental health care agent, sort of like a power of attorney for your mental health care, right? It's a very important role, but again, it's not required. If you or the person in your life doesn't have someone that is that close to them that they trust, like it doesn't have to be completed. You can still have the first part, like your preferences for treatment, without having to identify that one person that you trust to act as your mental health care agent. You can also have a backup for your mental health care agent. And again, both of these people have to sign. They have to accept this designation. You can't just assign it to them, right? So they have to be a part of this. This part here, general power. Yeah.
If I may add, this is Sherry. There certainly are people that would that believe that it's really important to have a healthcare advocate appointed and someone to speak for us when we're not in a very good place to speak for ourselves. But I'm of a mind that if you don't have somebody that you can trust who really will honor your wishes and advocate for your wishes, not their wishes for you, you're better off to have the form stand alone.
Thank you, Sherry. I mean, I know that there are, you know, some members of my family that I would honestly trust a total stranger on the street more to care for me, or not a total stranger on the street, but like a licensed clinical social worker appointed by a court, I would have more faith in than some members of, you know, my family. I have a big family, y'all. So looking back here, you know, the general power, it explains what this form, what this power in the state of Georgia provides to the person who is acting as the agent. At the same time, we can impose limitations on the agent's ability to act on our behalf, right? We can, you know, for instance, if we have a trust fund, if we don't want it spent on whatever kind of specialist the healthcare agent might say, we might say, you know, X amount of dollars may be spent on my care, you know, whatever. This is where limitations on the agent's authority get put in. If you are married, things get complicated, right? If you have your spouse as your agent, or if you're going through a divorce separation period, again, also tricky. Part 3, other related issues, law enforcement. How do we react to law enforcement? It's important because like if we end up being transferred from one facility to another, if they have the option of not using law enforcement to transport us, if they know ahead of time that we react a certain kind of way, they can choose the alternative. Who's helpful, right? Who's helpful for us when we are dealing with law enforcement, and and help from others. Just who's our support system. Part 4 is just like technical, legal sounding stuff, but legal stuff that says, when this becomes effective. Because today I am not in crisis. I am not in need of hospitalization. So if I had a psychiatric advance directive, my mental health care agent would have no power over me today, right? That power would come into place, and it's not power over me as much as power to work for me. But it's only effective if I've been determined in the opinion of a physician or licensed psychologist who has personally examined me, right? They can't go off affidavits that people have provided to a judge or any of that stuff. It has to be someone who's personally decided that I need support, right? So we have to sign and date it, and it has to be witnessed, and it has to have a second witness, but it doesn't have to be notarized. And I mean, if you think about this as a wellness recovery action plan, like writ large, right? It's something that's binding to people. It's unclear in Georgia what exactly would happen to clinical professionals who ignored a psychiatric advance directive. But if we don't have all of this information together somewhere, I think, for me, just having the information available for my family, having it all together in this one place, having them know this piece of paper exists would be helpful for them. And it's helpful for the courts, and it's helpful for the other people when we are going through a crisis. I think that's it, Sherry.
Thank you so much, Chris. And just so you all know, we're at the table working on, trying to, figure out a user-friendly template and, maybe a repository for psychiatric advance directives. And certainly we're hoping to do some kind of statewide training project for peers who have interest in completing psychiatric advance directives. So if you all would stay tuned. Thank you so much.
All right. All right, so I guess I am up now. Again, I'm Rosalind Hayes and happy to be with you all. Chris, thank you for sharing the information about the advanced psychiatric directives. And something that has become clear to me, a theme that has run throughout this webinar, has been the importance of relationships and how relationships are tied directly to resiliency, or healthy supportive relationships are tied to our resiliency. Tanisha started out talking about being a parent, and something that became apparent in what Tanisha was talking about with parenting is that we do not come into this world knowing how to have healthy supportive relationships. And in fact, we as Sherry Jenkins Tucker is famous for saying, we live what we learn. Tanisha talked about how she was taught that punishment was the thing to do. when kids were a bit out of line or acting out, the example that she had was to punish, and she had to learn that punishment was not the way to go, that love and listening and allowing space was what was necessary within her household to build and foster supportive, strong relationships amongst her and her kids. Jennifer talked about being taught to be seen and not heard, and her voice was taken away, and she had to learn how to speak up for herself and how to advocate. Bill, a constant theme through what Bill talked about was connection and having people, having a social network, having people. Bill said he called someone every day. And I'm sure the people that he called were not people who activated him and made his pressure go up and made the situation worse. Chris, you all heard Chris just talking about how his family of choice is not necessarily those folks who are blood related to him. He even went so far as to say that he might trust a stranger on the street more than he would trust some of those people in his family. And I'm sure that these things resonate with some of you. I know for me they do. When we think about trauma-informed care and think about ACE studies, adverse childhood experiences, a lot of that goes to how we were raised and those things that impact the way we learn, how we learn to be in the world, how we show up in the world, and how we interact with other people in the world. And so what I'm going to talk with you all a little bit about is intentional peer support. And intentional peer support, I was introduced to it when I first came to the Georgia Mental Health Consumer Network, working with our peer support, wellness, and respite centers, because it's the model that we use at our centers. And it's a model developed by a woman named Sherry Mead out of Vermont. And it really, at its essence or at its core, intentional peer support is a framework for healthy, supportive relationships. Again, it's not something that we're taught. We just kind of, blunder around. I know I have, and just bounce from one unhealthy relationship to the next, and even when we get some tools for building strong relationships, it's something that takes work. It's all of this stuff takes work. It takes maintenance. It takes, some willingness to give and to compromise and to continue to find ways to learn, to grow, and to connect. And so when we think about intentional peer support, it really is, there are three principles of intentional peer support. And the first is shifting from helping to learning. And if we think about our relationships, often those service type relationships that many of us have had, being people who have found ourselves in the traditional mental health system, those relationships, it's all been focused, oftentimes on helping. What is it that you need? They're one-way relationships, what do you need? How can I fix you? What is it that you're lacking, focused on lack or on deficiencies rather than on strengths and what, the other person has to give. They can set up situations where, Denise talked about that importance of hope, where the peer, I can feel hopeless and helpless, and that someone else outside of me has all of the answers, and someone else outside of me has, the key to my happiness and wellness, and not recognizing that, within me, all those things lie within me, and so we want to shift that focus from a one-way helping relationship to a relationship that flows in two directions, where there is mutuality, and we recognize that both people in a relationship bring something of value to the table. The second principle of intentional peer support is shifting from individual to relationship, and that falls right in line with what we were talking about, or what I was talking about when we're shifting from helping to learning, right? When the focus is always on one person, it creates, again, this imbalance in power. And the message is that, I am somehow, broken, and that I'm incapable, and that, I need all of you all to take care of me, you know, and when we are able to shift from that focus being on one person, you know, well, how were you this morning? What was your bowel movement like this morning? You know, I mean, it gets that personal. It's all about, you know, you, and someone just questioning everything about you as an individual. Can we bring this thing back into a relationship model where both people, again, are important and matter in this thing? And the final or third principle of intentional peer support is that shift from fear-based responses to seeing hope and possibility. And this is about, you know, seeing strengths in folks, you know, and not, you know, just because a person has a big reaction or a big emotion, you know, feeling so afraid that we have to lock them down. You know, this is the reason we need to have this advanced psychiatric directive, because, you know, when I start to have some big feelings, or even when I might be sliding into crisis, you know, I should still have some autonomy in this situation, you know. And oftentimes people see some behavior that makes them uncomfortable, and the response to that is, oh my God, we have to make it stop. You know, if this happens, you know, and when I see this person act this way, then the fear is something terrible is going to happen. And so we have to contain this. And so, you know, in relationships, when we can sit with some discomfort and really give some of that space that Tatanisha was talking about, for folks to figure it out, you know, when we can have a different kind of response. Oftentimes, if I respond to you with fear, it's going to make you afraid, you know, and you might be just fine, really, but my fear response could cause you to start to question what it is that you're experiencing, and question what it is that you feel within. And so when we're able to respond or start to see hope and possibility, it's a game changer. And the way that we're able to achieve these three principles is through the 4 tasks of intentional peer support. And that first task is connection, you know, and we really are seeking ways to connect. So often, particularly if you're in the traditional behavioral health system, or you're living with behavioral health challenges, our relationships break down. You know, our broken down relationships could be a part of what got us there in the first place. Not having those people, not having those supportive relationships. You know, when I mentioned ACEs, adverse childhood experiences, the number one resiliency factor is having somebody in your corner, somebody who sees something of value in you, someone who takes a concern, you know, who's concerned about you and takes an interest in you. You know, and it might not be under your roof. It might be the teacher who, you know, took the extra time with you, or it might be, you know, the neighbor down the street who, you know, gave you a snack every day on the way to school and stopped and talked to you. But having connection, even one strong connection, is a major factor when it comes to resiliency, especially in children. But even, you know, as we grow, having those connections is important, and having those healthy relationships. And anybody, you know, here I go with my Brene Brown, you know, she says connection is the energy that's created when people feel seen, heard, and valued, when they can give and receive without judgment and derive strength and sustenance from the relationships. You know, that's the kind of connection that makes a difference. That's the kind of connection that supports our wellness and resiliency. And you know, it really is quality over quantity. You know, in our RAP plan, you know, you got to have more than one person, because you don't want to just burn that person out. But our RAP just have at least 5. You know, that doesn't mean I have to have, you know, a whole legion of friends and support. You know, at least 5 though. And so, and really, you know, taking time to build those relationships, you know, because again, it's work. Relationships require, they're living dynamic things that require, you know, maintenance and attention. And so, you know, if I have those 5 people that I really am able to achieve meaningful connection with, and I'm able to negotiate and maintain those relationships, you know, that would be great towards my resiliency. intentional peer support, we talk about connection, we also recognize that disconnections happen, you know, and work on ways to reconnect. Now, there might be some relationships that when the disconnect happens, they should stay disconnected. We don't need to try to reconnect to those. But there are others that are important and that are meaningful, and you know, we want to be able to reach out and reconnect. And during times of crisis, you know, that's when those relationships can really become strained and stressed, and you know, reconnection might be difficult. I know when we're talking about disconnects and reconnects, I know in my own family, I've seen family members, you know, sisters disconnect and not speak to each other for 10 years. You know, that's a long time. There's lots of relationships that are meaningful for us that, you know, that disconnect, and we don't know that reconnection is possible, and we don't know how to go about it. And so, you know, that is something, an important learning that comes from intentional peer support. The second task of intentional peer support is worldview. And that really is considering how we come to know what we know. How are we informed? How did these beliefs come about for me? Where did this stuff come from? You know, and if we can be curious and open with each other about worldview, about what my experience has been, because my experiences inform my worldview, you know, and so that's going to inform how I show up. And so if all my experiences, or much of them, have been traumatic, for example, then that's what you're going to see when you see me. You're going to see some of my trauma responses, you know, and being able to get in touch with those things, having some compassion and empathy as we start, you know, as we're learning and growing together. You know, we can recognize these things in each other, and you know, recognize some more healthy ways of showing up and responding in the world, those things that will support our resiliency. Some of those domains that we talked about with the Wellness Recovery Act, or with the Whole Health Action Management, those 10 domains, you know, we are able, our brains, there is neuroplasticity, and we are able to create some new neural pathways and new ways of responding that support our resilience. Mutuality is the third task of intentional peer support. And, you know, that's about, if it's not working for both of us, it's not working. You know, it's about us taking care of the relationship rather than what Denise talked about, us taking care of each other. You know, she talked about, you know, I'm always there. I'm doing for others, you know, and I can certainly identify with that, and how always putting other people before us, and always putting others' needs before us, before our own needs, can find us lost, you know, and disconnected from ourselves, you know. And so it's important to be able to have that voice to say, hey, this isn't working, or to say, you know, when this happens, I feel this way, and this is what I need, you know, so that this relationship is working for both of us. Because again, mutuality says, if it's not working for both of us, it's not working. And I'm sure you all can think about many relationships in your own lives where, you know, I'm hanging in here and I'm staying in here, but it's not really working for me, yet I continue to stay. And it's having a negative impact on me because I haven't figured out how to say what I need, or to walk away if necessary. You know, I haven't found my voice. I haven't found the way to say, hey, this just is not working, and this is what I need. And so that's what the mutuality, when we're talking about intentional peer support, looks like. It's about negotiating, and it's about reciprocity. You know, there is an exchange that happens in our relationships. And again, they're not just one way. And lastly, when we think about intentional peer support, the fourth task is moving towards. And that's the focus on what's possible. It's a focus on what we want, you know, rather than what we don't want. You know, there's that saying that says what we resist persists. And so when our focus is always on those things that we don't want, we stay locked to those things, you know. And intentional peer support, we're talking about where we're going. What kind of life do we want to have for ourselves, and how can we achieve that? And you know, what's possible, and that moving towards kind of really comes together when we're with someone, or when we're connected, when we are able to be open to different worldviews, and when our relationships are reciprocal, and mutuality is in play, the relationships are working for me, then it's easy to build on what it is, or to see what I want, and what I need. Oftentimes people, we forget how to dream. We lose touch with our passions, as we go through the system. And intentional peer support is one of those things that can get us back in touch with those things that really motivate and give us meaning and purpose in life, that 10th domain in the whole health action management plan. And so if everybody would mute themselves, that would be great. Thank you. And that is a basic overview. We have 5 minutes left. That is, thinking about really healthy relationships, and the importance of relationships when it comes to resiliency. And so thank you all for the time. Thank you for today's topic. And Emily, I will give it to you.
All right, thank you so much, Roz. It looks like we have just enough time for our evaluation today. I'd like to really thank everybody for attending. If you just attended this session, thank you. If you've attended more of the sessions, or all 4 of the perspective and crisis sessions, thank you so much. And I want to extend a special thank you to Roz, Chris, and Sherry, and to all of our panelists from the Georgia Mental Health Consumer Network, who have led these sessions and provided such great information for all of us. I am going to go ahead and drop the SAMHSA required evaluation link into the chat right there for everyone to click on. If you would mind filling out this evaluation survey, it really helps us send information to SAMHSA so that we can continue providing trainings or events like this one. And while everyone is looking at that, I will turn it back over to Sherry super quick for any closing remarks.
Just wanted to thank everybody so much for joining us, and everyone so faithfully stays on for all of our session. I particularly want to thank our panelists, Bill, Jennifer, and Tatanisha, Denise, Roz, and Chris, for your valuable and insightful information, and always to the Southeast Mental Health Technology Transfer Center for including us in this most valuable work. You all have a great day.
Thank you all.
Thank you, everyone.
Bye-bye.
Thank you.
Have a good one.
Thank you.